Well, one of the things that we're going to be able to do is really enhance our simulation. All the allied health professions, including the paramedic program, we have to prove that we have our students are competent. And we do a lot of competency-based learning. We use simulations a lot. Here, we're going to have an apartment complex. We're going to have an indoor ambulance. We're going to have the simulated emergency room. So when we are running scenarios, we're going to be able to run it with the real life feel of what's going on out in the field. The instructor is no longer going to be in the room. The instructors, whenever you have an instructor in a room, the students tend to focus on the instructor. Our instructor is going to be removed now and looking remotely because of our camera system that we're going to have with this new facility. So the simulators that we're getting are also very advanced. They can do everything. We can talk through them if we need to, but they have pulses and blood pressures. They blink, their pupils change, they react appropriately when given medications. They have lung sounds. They can bleed, they turn colors, they have seizures. So you can see that the simulator doesn't require any input from the instructor. It's very artificial for us to say the patient is now bleeding or the patient is now having a seizure or now has cyanosis. The patient simulators will do that. So not only are we replacing the students in a real life setting, such as an apartment or inside an ambulance or an emergency room, we're also adding the technology to let the students have a simulator that can mimic. It's almost eerie how much they can mimic a real person. So we can make changes based on what the student does. If they do something wrong or they go down a different road. Let's say, for example, a student gives the wrong dose of medicine. Of course, we don't want that to happen, but if it does happen, we want it to be in the lab. So we would punch in, the student gave this dose of this medicine, and the simulator reacts appropriately. Surge tech and rad tech, and we have nursing and paramedic, but also on the Con Ed side, we have CNA and GNA and dental and I'll forget someone in this whole, rattling all this off. And one of the things we want to do too is we want to expand our offerings, so we're actually giving more offerings in continuing education. So doctors and nurses and paramedics come here to receive continual education, advancing their education and using our facilities more than what they're using it now.
I think that's one of the interesting part about the project, that a lot of times people may not realize that, putting allied health and athletics together, and actually I think that there's a good combination, especially nowadays. I think that there are new areas of learning, rehabilitation for some athletics. We have a good team, there's a lot of communication between a lot of us. Actually, some of them, you can almost say that it's 24/7, type of communication. We are on time and we are on budget, which is a couple of things that are very demanding for a project this size, and the timing that we had 18 months to work on this project. So going to college, I think, is such a wonderful experience, And for some members, some students that we have, they are the first generation of attending college. Having this building out here at the main campus, I think it brings a lot of positive, and that experience of attending college for everyone, for the students, faculty, and the staff.